I have not driven. My Jeep is a 2017. I have 30,000 kilometers on it. I don't go nowhere. This is like a big thing for me. I can't even believe how much I look forward to coming here. It's ridiculous. I have never felt so a part of something that I was only reaping the benefits for. You know, like I've had filler, I've had Botox, I've had it, I've paid and left. And there was no personal connection there. And I've trusted you to touch me under my skin like my face is all I've ever had. Because when I grew up, being plus size was not acceptable. Mm-hmm. So I was always the pretty girl that if I was skinny, I would be beautiful. And now plus size is acceptable. Mm-hmm. And you helped me keep my diva in my 50s. Because I'm at that point where it's like, should I be dressing this way? Damn right I should be. Mm-hmm. You know, and it's just you give women like me the hopes that I can continue and keep my vanity as long as I can. Because I'm going to be that 80-year-old woman mm-hmm. in the sequin skirt. It's just my mechanics.
Yep.
It's who I am. And I love technology. I don't know if you know this, but my cousin is a model and her husband is a cosmetic surgeon.
Oh, okay. I didn't know that.
They have a practice in Miami, in
mm-hmm.
Boca.
Mm-hmm.
That aside, I can get a good deal. I can go that route. And it's an option and things like that. But there are a lot of factors that affect somebody who want to go that route that don't affect sitting in your chair like a BMI. So in that sense, I hope to be the education between people's decision. Because mm-hmm. women like me don't always have those choices mm-hmm. because we're at risk to be put under anesthetic. Mm-hmm. Whereas you offer the same thing while I'm awake and I can recover in my home and I'm healthy. Mm-hmm. And you haven't risked.
And you can do as big a procedure. I can do it as big, or I can do it like more nominal for a little less healing time. But I just have to see you more frequently. So I just change the treatment plan depending on, you know, what the patient's comfortable with.
So for me, it's been great.
So are we ready to do her face inside?
I have a colleague at work who is around my age, numbers wise, has a different profile than myself. She has lost an extreme amount of weight.
Okay.
She's got, a significant sagging on her face without any volume behind her cheeks.
Okay.
And what she is worried about and had a question was if this is a route that she goes for facelift surgery,
yes,
and she continues to maintain, given that she doesn't have the volume, will the threads cause any problems between her skin mm-hmm. and anything that she has left if she was to continue with the process?
Is she interested in having a facelift?
Yes.
Like an actual surgical facelift?
Or she's not ready for that at this point.
So she was more interested in a thread lift to buy her some time and give her some rejuvenation in the meantime. If there is some significant volume loss, I still in general, because I'm capable of doing very thin skin or more sagging skin, I will still give her a thread lift to start with and see if she's, how old is she, around 50, 45?
I think she just turned 49.
Okay. So she's still at an age where the threads will give her a good amount of collagen boost, because as they dissolve, they're going to create some nice organized scar tissue under her skin where the sutures are laid. And if necessary, we'll add some volume. You know, we can use Sculptra, we can use different types of fillers, but generally, I always lift first and I bring the patient back to volumize if necessary on the follow-up visit, usually in a month's time.
Okay, which is where I'm at, exactly. I have another question.
Go for it.
Just so that your viewers are informed, can we speak a little bit about the healing process and what to expect? Mm-hmm. I know what I've been through and experienced, but I'd like for everybody to hear it from you professionally.
Well, every decade will cause a little bit of a difference in the quality of healing, okay? So when I have my 30-year-olds come, they literally need a little bit of a mid-face lift. They're the same patients who will go in and buy one syringe of filler, and they'll get a little bit put everywhere, and they look popped and they look great and they'll come back in a year. So those people are the same ones who I do a cheek pop for threads. And essentially 2 weeks or so of a little achiness under your skin. You definitely know that your face has been lifted. I would say it's a bit of a headache under your face. Minimum to no trauma or downtime. They can go back to school, work, whatever they're doing the same day, and they just look and they feel great. Sleep on your back for about a week or so, and you'll be fine. But every decade, you're going to have a little bit more time for healing. So we'll push over to the 40s. In the 40s, now we start to do more of a full mid-face, full contouring, full jawline lift, and you could get away with one procedure, maybe 2 procedures. Generally, I would say after 40, you're looking at 2 procedures a month back to back for a more full type of result. So they're going to have about 2 weeks more of healing. So the same thing's going to happen instead of 2-3 days. It's going to be about 2 weeks of owiness, maybe a little bit of swelling. Nothing that you're going to really notice. I think you notice it because you had it done, and we look at after a thread lift, you'll be staring in the mirror like, oh my gosh, am I more swollen today? A bit more. So by day 3, day 4, there's a natural inflammatory reaction. You'll have a little bit of swelling, then it subsides, and before you know it, you're back in my chair at 4 weeks, and we take your after picture, and it looks fantastic. So really the downtime is now we'll go to 50 and 60. Every decade, there's a little bit more work to be done in the first appointment. So there's a more dramatic procedure, so there's a little bit more downtime. So that 50 plus person, the 60 plus, 70 plus, they will feel that they are healing for about 4 weeks. Yeah. They don't look crazy, they look great, but they are sensitive up to 4 weeks. So that's really what the big change is with every decade.
And my last question that I have, it's more of I wish I knew then what I know now. So for my colleagues that are asking this question is, when is the ideal time to start with threads so that you can optimize your youth as you grow older?
I was 41 when I first started threads. I had pretty good skin because I'm in the industry. I was using all the modalities possible, good facials, good skincare, and I think that it was pretty good for the 40s. But I think if you, instead of getting 2 vials of filler when you're 27 or 30, 35, I would suggest if you don't have volume loss, just come and get some threads. So really at your first sign of descent, which could be late 20s up to mid 30s, before you even jump to the idea of getting filler, come and get some threads. Find your provider. In my website, I'm going to be having a list of TMK trained providers who are out there. So if you're like, let's say you live in Sudbury, you can see, okay, Dr. Barr, there's threads in Sudbury. So you can go to Dr. Barr, right? So there'll be that kind of support for people to go where I've trained those students and that they're providing good results. They've been gone through my academy, they're providing good results. So I guess my answer to you is, when you see descent, come and get some threads. It's natural, it's a starch at the end of the day, it's very easily accepted by the body, it's very safe, it's not going to migrate into a vessel, and even for the injector, it's safe for them to do. And you're going to get that nice JLo snatched face. Who doesn't want to look like her cheekbones? So the sooner the better. 30s is probably a good idea. If you do think you're going to need some augmentation, start with threads.
People are asking the right questions. I did my research by viewing her page and keeping in the know and up to date. And I think for anybody that's interested, do your research. I confidently sit here knowing that I feel confident in my practitioner. I feel confident in the process, her experience, the fact that she's a wealth of knowledge in teaching others. So that is where I am here today. Do your research, be in the know, ask the questions.
I want to ask you one question, just about healing. So you've had one procedure with me, you're 50 years old, and I want to know, how was the last month?
Where to begin?
So you had your procedure, you left your office.
I did.
Yep.
It was described to me that it would feel as if I had a headache under the skin. So what I used to tame anything that was a little unmanageable, which it wasn't at all, was I used Tylenol. Nothing stronger than that was required. The first 2 weeks, extremely tender, nothing that you could see visibly. In fact, I was loving my new look. I had little changes, subtle changes that we take for granted, like the aging behind our ears, where I was pulling my ear to put in my earring. So little things like that were a bonus to the overall youthness. Now, going back to the healing, of course, anytime you do something extreme like that underneath the skin, you're going to have that tenderness. Although nobody else can see it, you definitely can feel it. So you need to treat your body, wherever you've had the procedure done, with a little bit more respect and love than you did prior. So
Yeah, it is in office surgical day surgery type of procedure.
Yeah.
So even though you're having in and out, you're very right. Treat it as if you had day surgery, and
Yeah.
respect your face and your skin, and look after yourself.
Exactly, and do little things. Washing your face is still very important, and the tenderness can maybe persuade somebody to do their routines a little differently. What I did is I went and bought a little handheld facial scrubber, which was very gentle, and I was
That's a good
able
idea.
to keep that, refreshed, healthy glow and clean pores. So just know to expect that anything that gives a reward like this, of course, you need to allow the downtime. Give a little extra care with your sleep, get a little soft pillow. In the end, the results they've been very changing for me. It's given my smile a little extra gleam. I feel better when I leave the house. So the healing portion, although those 2 weeks, they're just you have a little bit of tenderness. The rewards stay with you, going forward, and it's been so worth it for me. So here I am back.
Yay! We're gonna take you now.
And I'm very excited. Just know that it is something that you're doing to your body that does have this discomfort. You need to take care of yourself. Follow through the rules that are given after the service. Listen, ask the questions so that you can manage. And just know that Nicole, her assistant, has been available to me for any questions that I had to make me comfortable along the way.
Thank you so much, Shirley. I'm
Thank
so
you.
excited. We are going to be posting a post-procedure list that I do give everybody when they leave here, to give them recommendations for post-procedure care, because I can talk to you, but by the time you leave here, you forget what I told you. And I'm going to take Shirley now into the operatory to give her second procedure, and follow us there. Thank you, Shirley.
Thank you.
Like, do you feel sharp?
No.
Okay, that's what I need to know. Tapping is okay, but you shouldn't feel sharp. looks amazing. Now I'm just going to do your bio mesh. See here. So I'm filling this area, adding a little bit more bony structure to this. So I'm going to just poke here, lidocaine. Okay, same thing on the other side.
Becoming a model for your training classes. My profile, I'm not a good candidate for that. I prefer to come to the boss woman. But what would be an ideal candidate for a model for your training?
You know, the students are, well, like nurses or doctors who've been practicing. They have to have the prerequisites. So they are advanced nurses and doctors to begin with. So, you know, you're not like you're putting your hands in somebody's hands that probably, I would be teaching them if they weren't good
Right.
students to be with. But generally, it's anybody who maybe you want to try this and you don't want to pay the price that is more expensive when you come to me, for sure. And you want to just try a small area or two small areas, and you can come in and you're paying $400. So it's a little bit, it's more reasonable for them. But you know, naturally, you're going to be there, and you're allowing for the students to have experience, and we give you that little bit of, you know, the economy back in your hands to make it more reasonable for you to be that. That way, if there's something that you really love and you loved your experience, then you know, then you can come and have a bigger procedure done, or come to me, and maybe that's all you need just to gain some confidence in the procedure. But generally, anybody who wants to have it, you know, it's fine. Then they can come. Anybody's a candidate. If you have a lot of sag, I suggest probably we do kind of look at all the models. We don't just let everybody come in. If you're much older or really thin skin, that is for an advanced injector. So when I have advanced trainings, I be right on there. This is like second time training. I have a nurse coming in September, and she's coming for a second time training. And for that person, I would allow, you know, models who have more severe sag, who are older, have thinner skin, because she's coming for that purpose. She wants to have, you know, a more advanced training for more complex cases. So, you know, we sort of try to triage those pictures and the faces depending on the type of students we have. That's also Nicole's job.
Okay.
So she triages the people who are calling.
And just for those that are viewing, I had a video FaceTime call with Kay prior to my services. So she was able to take a look at my profile and give me an idea of exactly what my treatment plan would look like and what to expect. So that's something that you also experience through the process. So you've got that confidence going further where you've been assessed. And it gives you an idea of what to expect.
I'd like to also just meet everybody once on FaceTime, on a video consult before them coming in, and just to have that one-on-one before they actually do come in.
Yeah.
There. Now I'm just making sure those sutures are all settled in and there's nothing left that engaging, right? There. Oh, you feel that pop, pop, pop? That's very normal, okay?
It's better than the filler.
Well, it's totally different, right?
Yeah.
We can't fill these areas. They definitely need lifting.
No, the popping.
Oh, yeah. Okay, we're all set.
Wow.
That is done. Done and done. I'm going to have you sit up. I'll let you see.
This is the part that's touching.
There you go.
Wow. This is just shocking. Wow.
Yep. So next time when I see you, I'm going to be actually using a little bit of fat dissolvement, and then we're going to do mono threads in here, and that is going to really just give you like whatever's like still holding here. But I put two 18 gauge sutures crisscross down here, so in a month I'm going to see what's left, and you see this? Look, that's what's going to happen. So we're getting there. We're just about there. One more procedure.
So I do have one question. My next appointment with you is September the 9th, I think. So for that appointment, am I good still to go so we can do upper
Yeah,
or should I?
we can do
Okay.
upper for your next appointment. We'll let this part heal, and of course I'll have a chance to assess it. But these will be all like mono sutures that we're going to be doing. Their job is to tighten loose skin and to melt fat. It's a combination, so it's a lot of fun. It really is a lot of fun. That the scaffolding that we can produce in holding this back, it's like a mesh that we create under the skin. It just holds everything in place. Then I'm going to use a Tegaderm, very clear dressing. It's going to go like a bandage right on top to support it while it heals.
This is so exciting. It's addicting.
It's
It
a good
really
addiction.
is.
It's a good one.
I feel as if I leave, the confidence that comes behind this, just to buy back a little bit of the time that I lost, has felt like Christmas in July. It has, every day. I put makeup on again. I am participating in life. And you have just taken so much physical pain off of my face. And I love you guys. You just
Thank you so much, Shirley.
Thank you.
How do you feel out of 10?
feel-
Out of 10, like being,
And
as far as
that's-
discomfort goes, like how achy do you feel?
As you saw, I hardly moved during the process. It's painless. It's very comfortable, and in leaving, I feel firm. I feel snatched. The red light therapy gave me
so
that
good.
added. It's just it's like you're sculpting,
Yes.
and if there's no pain at all.
Thank you so much. I hope you guys all enjoyed it. Don't forget to subscribe.
Yes, if you had any questions.